We've completed several mock MMI circuits with our students this year. We've noticed some general trends emerging. Many students have interviews over the next few months, so I'm hoping the anecdotes I'm about to share will be useful to you. Several students responded with stunned silence when asked about something negative or challenging in their application or personal statements. Be prepared to talk about your weaknesses as well as your strengths. Do you even know what they are and how you can mitigate them or improve them? Patients have a right to refuse treatment, and many have different ideas about the treatment they wish to pursue. You will need to address this in your answer. It is important to employ empathy skills and try to discuss things from your patient's perspective. Don't forget, you need to include other perspectives also, i.e. your perspective as a clinician, carers' perspective, i.e. parents, carers and so forth, and also what about the organisation you work for? Consider also how cost of living crisis, deprivation, housing crisis and other social and economic factors are affecting people's ability to seek healthcare. Remember, you're attending a medicine interview, not a law interview. If the question is related to the duty of candour and making a mistake, do not focus on denying liability or insurance. Doctors must deal with conflicts all the time with patients, colleagues, media and so forth. You need a structure in approaching role plays as well and discussions around that. You may have verbally direct a patient with disability such as visual impairment to perform a task. The patient may also make mistakes and you must respond to this. In some questions, students could not give personal examples of how they have demonstrated leadership, teamwork and other qualities of a doctor. These should be revised before the interview, so you're not thinking on the spot. Take care with questions that relate to a potential breach of confidentiality. Medical information can generally only be released with consent from the patient. Think about any scenarios where breaching confidentiality could be justified. Some candidates were unaware of how social media can impact healthcare, let alone how to respond to negative criticism online. Candidates should review their own school, college's social media policy. GMC, GDC, they've all got guidelines on it. Read it. Surprisingly, candidates knew little about the background and reasons for current doctors' strikes involving consultants and junior doctors. This knowledge is needed to make informed answers relating to this topic. In addition, questions relating to the NHS, A&E waiting times, they could have been answered better. So you need to stay up to date about hot topics, current trends, and what made the headlines in the last 12 months around health and social issues. Questions relating to euthanasia weren't answered all that well, but most were, to be fair, but there was confusion over assisted suicide and the role of doctors practicing in the UK. What are the rules in the UK? I hope you find this feedback useful and I hope it helps with your revision for medical and dental school interviews. If you want to gain knowledge and skills with us, then by all means come to our next course. Check online for dates and times and I hope to see you there.